This video will show you how to properly administer your medication via a Freedom 60 syringe pump. Please follow all instructions shown in this video. Administering medications via your Freedom 60 syringe pump can be safe and easy. Your home health nurse will be available to instruct you on the procedure following discharge and will visit weekly and as needed for your catheter dressing change and any labs your doctor has ordered. Please begin by preparing your work surface by cleaning the area thoroughly with soap and water or a disinfectant wipe, and drying thoroughly as well. Wash your hands thoroughly for at least 20 seconds. And dry thoroughly as well. Use a separate towel to turn off the faucet. Gather your flushing supplies, the Freedom 60 tubing, your pump, and any other supplies as directed. Prepare all the pre-filled syringes of sodium chloride, also known as normal saline, and heparin if indicated, by holding the syringe with the tip in an upright position. Gently pull back on the plunger, then push gently forward on the plunger to expel any air that is in the syringe. Do not touch the tip of the sterile syringe. Once again, gently pull back on the plunger, then push gently forward to expel any air that is in the syringe. And please do not touch the tip of the sterile syringe. And finally, if heparin is indicated, once again gently pull back on the plunger and push gently forward to expel any air that is in the syringe. Do not touch the tip of the sterile syringe. Check the label on the medication for the correct patient name, drug, and frequency. Inspect the 60 milliliter medication syringe for any cracks, leaks, particulate matter, and clarity of medication. Verify that the tubing you received is labeled Freedom 60 tubing. Remove the tubing from the package. Remove the cap assembly from the end of the medication syringe. Using the sterile technique, remove the sterile cap from the luer disc end of the Freedom 60 tubing set and connect to the pre-filled medication syringe. Ensure the Freedom pump's on-off switch is in the off position, and the black tab in the syringe shield is at the end of its track. To move the black tab to the end of the track, wind the large knob clockwise. Do not overwind. Insert the syringe with tubing attached, Plunger end first into the clear cover on the pump. Keep the syringe graduations facing up. Make sure the luer disc of tubing is fully seated in the pump's nose. Prime the tubing with the pump by turning the pump to the on position. Hold the syringe in place while the black tab searches for the syringe. A whirling sound will be heard until the black tab reaches the syringe, followed by a click. Medication is now being pumped through the tubing set. When all of the air bubbles are gone and the medication starts to drip, put the cap back on. Priming is now complete. Scrub the hub of your injection cap vigorously for 30 seconds with an antiseptic wipe and allow to dry for 60 seconds. SASH method. S stands for sodium chloride. Attach the pre-filled syringe of sodium chloride to the end of your injection cap by pushing and turning clockwise to secure the syringe in place. Flush the catheter with the prescribed amount of sodium chloride as directed by your nurse using a push-pause method. Disconnect the syringe. Scrub the hub of your IV catheter with an antiseptic wipe vigorously for 30 seconds and let air dry for 60 seconds. Remove the end cap from the Freedom tubing set and attach to the injection cap of your indwelling IV catheter. Administer the medication as directed and according to your Chartwell Plan of Treatment. SASH method. A is for administer medication. Monitor infusion progress while medication is being dispensed. This pump is spring-loaded and does not alarm when finished or if there is an issue with the flow. When medication syringe is empty, infusion is complete. Turn pump to the off position. Disconnect the tubing from the injection cap of your indwelling IV catheter. If another dose of medication is to be administered the same day, place a light blue tip cap on the end of the Freedom tubing using sterile technique. Scrub the hub of the injection cap with a new antiseptic wipe for 30 seconds and allow to dry for 60 seconds. Attach the second sodium chloride syringe to your injection cap and flush the IV catheter with the contents. SASH method. S stands for sodium chloride. Disconnect the sodium chloride syringe. If your IV catheter requires the use of heparin, scrub the hub of your IV injection cap again with a new antiseptic wipe for 30 seconds and allow to dry for 60 seconds. Attach the pre-filled heparin syringe to your injection cap and flush the IV catheter with the contents. SASH method. H stands for heparin. Disconnect the heparin syringe. Rewind the knob clockwise, moving the black tab to the end of the track. Do not overwind. Remove the syringe from the pump by gently pushing toward the plunger, then lifting up. Leave the empty syringe attached to the tubing. If tubing is not to be reused, discard into an appropriate container. All supplies and syringes can be double-bagged and disposed of with your household garbage. Wash your hands thoroughly. Properly administering your medication via the Freedom 60 syringe pump at home is important to your safety. Please call 1-800-755-4704 if you have any questions or concerns at all while administering the medication. We are available 24 hours a day, 7 days a week. In the event of an emergency, always call 911.